Hi, Dr. Glenn.
Hello, Pamela.
Thank you for being here today.
Thanks for having me.
So Naples Regenerative Institute,
Yes.
the name of your place, and it's right on Tamiami Trail North. And we can find you over by, it's like right over by the Posh Plum.
Yeah.
The locals will recognize.
Yeah, not too far from the mall.
Not too far from the mall.
Near Zazu, Soul Salons.
Zazu, I always see that sign. So we can find you there. And you help us with our joint pain, which is something that I've experienced personally recently.
Yeah.
But so tell me a little bit about how you initially got into this field.
Sure. So it kind of all goes back to my original training in anesthesia, pain management. So I did traditional pain management for about 1.5 years right out of fellowship, which is a lot of injections with steroids, a lot of radiofrequency ablations where we burn nerves so people don't sense pain, a lot of medication management. So that was the first time I had like true follow-up for all my patients where I saw them every single time. Every month they came back and people were just not getting better. So
Wow.
yeah, it was kind of a point in my career where I was thinking about leaving pain management and going back to anesthesia. And then I was approached by someone who wanted to open a regenerative medicine clinic, which I hadn't really heard much about. That was like 2015, 2016. So I kind of went back to school. I started traveling every month to get training in Colorado for 1.5 years, and I learned about this field.
Very
pretty
cool. So can you tell me a specific success story that you might have had that could inspire our viewers?
Yeah, there's so many. So the spot that gets probably like the most press and has the most research is, let's just say, knee arthritis. Mm-hmm. So just, at this point, dozens and dozens of patients who had tried the traditional injections and medications were at the point where the recommendation was a knee replacement, and we have studies that followed this same protocol. So you get patients that are just destined for a knee replacement, nothing else is working. Yeah. And then you do a really good, like high quality, high dose PRP injection, and you don't see them for a couple of years because they're doing well. So like that happens all the time.
Wow, that's great.
Yeah.
So you can put off a major surgery.
Yeah, even when you're that close to like needing it,
And then the recovery for something like that would be about how long?
Like next to nothing.
Wow.
Yeah, so anytime you inject like platelets, plasma, bone marrow cells into the body to stimulate tissue to heal, there's like a 2 to 3 day window where things are inflamed before you start the healing process. So everyone can be stiff, sore, achy, flared up for a couple of days. Some people not much, some people, pretty stiff and sore. And then after that, it's just kind of activity as tolerated. So it's not like a big recovery from an injury or from a surgery.
Great. So can you tell me who would be the ideal candidate for this type of modality?
Yeah, so, typically a healthy person is going to do better than an unhealthy person. Mm-hmm. So that can be like chronic medical conditions. So if people have autoimmune problems, diabetes, if they're obese, if they're not active, don't exercise, things like that, they don't do as well.
Yeah.
But at the end of the day, these treatments are still better for them than the traditional treatments are. So, these treatments help everybody, but someone that's like young, healthy, active would like be more of a slam dunk for these treatments.
Yeah.
But it helps people into their 70s, 80s, 90s as well.
Cool. So what are some exciting things for the future of PRP that you might see coming up?
Yeah, so like people that are kind of really deep into this field are not asking whether or not PRP works anymore. Like there's so many studies, hundreds of studies that show that it works.
Yeah.
So over the last 5 years, we've started actually looking at the dose of platelets, and then not just the platelets, but the other cells, like the other white blood cells that are in the product.
Okay.
So we've started figuring out like what dose of platelets you need for a joint versus a tendon, how many neutrophils you want to leave in for treating like into a disc in the spine versus, a joint around the body. So like really fine tuning like the best type of PRP and dosing it appropriately is pretty cool.
Cool.
So yeah, not all PRP is the same.
Yeah. So how do you address skeptics, whether it be patients that are skeptics or your colleagues?
I mean, at this point, I just, I have a bunch of studies that I just go over with them. There's so many studies.
Yeah.
And I understand the skepticism because I was skeptic when I first heard about it.
Yeah.
But now just really like deep diving into the field for the last, let's see, almost 10 years now, you know a lot more than the general public about what's going on. And
Yeah.
at this point, I'd say the patients are like so well educated that a lot of them know more than 99% of the doctors. Like half the patients that walk in my clinic are like you, like talking to me about studies,
Yeah.
which was not happening 5 years ago.
So a lot more
yeah,
education.
once you review the evidence, then it starts to make sense.
Yeah. That's great. So what are specific joints or conditions that you would recommend PRP for versus other modalities?
So the most evidence, like I mentioned, is for knee arthritis.
Okay.
And, we can kind of extrapolate that to other joints, like there's not going to be a study done for every joint in the body.
Yeah.
But definitely arthritis and, mild, moderate, or severe arthritis. We have people that respond better if it's mild to moderate, but it still works in severe arthritis.
Wow.
Then when we're looking at muscles, if you get like a low dose PRP, or sometimes we use what's called the platelet poor plasma. So it's kind of the leftover plasma after you make PRP,
Okay.
and that's shown to help muscle tears heal.
Oh, very cool.
If you have tendon tears, ligament tears, tears in your discs, in your spine, you can inject PRP and get all that tissue to heal. So, I mean, it pretty much works for all of the musculoskeletal system.
Okay.
Yeah.
So what lifestyle choices might your patients have that you might want to steer them away from while they're having their PRP therapy?
That's a great question. So we have a sheet that we hand to all our patients, and usually we get some calls afterwards to review it, no matter how much we go over it.
Yeah.
But the main concept is, these treatments are going to boost your own natural ability to heal.
Mm-hmm.
So the healthier your body is, the better the outcome can be. So a lot of these things we talk to patients about, and you can do all these things before we even consider treatment and see how you do. So that would be, proper exercise, posture, biomechanics, around the joint that hurts.
Yeah.
Nutrition is a big one. So, we counsel on nutrition, sleep and stress, like how to get the proper sleep so your body can heal. With nutrition, again, like almost nobody eats enough protein, and you need a lot of protein and nutrients to get tissue to heal. So all those things can boost. Yeah, it really is. all those things can boost, these treatments. But I've had a number of patients who just say, well, let me try all that first, and then they get better and they don't even need the treatment.
Oh, that's great.
So yeah, they work well together.
Yeah. How do you tailor the way you inject to specific problems?
So I'd say the best thing to do with these treatments is, I'm kind of dancing around this topic a little bit, but you want to be very precise. So
Yeah.
there are a lot of clinics that will do things by feel when they inject, or, try to convince patients that the cells don't need to be like in the exact spot, like they know where to go. And there's not a lot of evidence, or there's no evidence that that's true. Mm-hmm. So if you want to get into a joint, you should use an ultrasound or an X-ray to see, the PRP going into the joint. If you want to get into a tendon or a ligament, you should actually see the needle in there. Mm-hmm. So we do everything under image guidance. It's kind of like if you're trying to dose a patient on insulin, you want to make sure that they actually take it.
Yeah.
Right? So if I'm trying to treat a knee joint, you want to make sure it's actually in the joint.
Oh, that's great. So you're the real deal over
Yeah,
there.
you could say that.
Yeah. And, patients aren't missing out on the important benefits, because if you're not using that, it could be completely lost in the tissues, correct?
Yeah. Yeah. So I see a number of patients that come in and they've had treatments that didn't work. And, you ask them about how it was done. And I'm not convinced that, one, they had a good PRP treatment. Mm-hmm. Two, it was injected into the spot it needed to be. But it's hard to convince that patient, that they should try it again. So hopefully it becomes a standard of care.
So it's really important to go to a really good place, a place where they know what they're
Yeah, like ultrasound and X-ray guided treatments is real important.
Very good.
Yeah.
So what are some common misconceptions that patients might have about PRP?
So, I mean, I'd say the one it's the most common about PRP is that like all PRP is the same.
Yeah.
And like I said, we're really honing in on doses that you need to get good outcomes. So, like, there's a study that shows if you get one of these patients that's at the end of the road with knee arthritis, if you get like 6 to 10 billion platelets in that knee joint, that their pain and function will improve out to 2 years, which is a really long time to study people. So that's a really good outcome. And a lot of clinics, they might get 1 billion platelets in the PRP they make.
Yeah.
So to try to explain that so they understand, not all PRP is the same is pretty important.
Yeah. Great. Now, looking ahead, what other treatments do you see coming along or enhancements to PRP? Is there anything on the horizon that you see coming up?
Yeah, so there's one in particular. There's a lot of non-autologous products, which means not from yourself.
Yeah.
So there's a lot of birth tissue products, whether it's from the umbilical cord, Wharton's jelly, exosomes, things like that, that just don't have any like clinical evidence at this point. There may be at some point in time, good evidence that they can boost the treatments we're doing. Right now, there's not.
Mm-hmm.
There is one company that is making autologous exosomes. So for that, I would draw someone's blood, and instead of making the PRP in my clinic, I would send it to this company, and they have like $1 million centrifuge, and they can create an autologous exosome product and send it back to us.
Yeah.
So that's something that that might be good in the future. But right now, like there's so much good evidence for PRP and how it works that you kind of just need that. You don't need anything else yet.
Okay. I heard you talk about the ablation therapy.
Mm-hmm.
Do you mind shedding a little bit of light on what that is and how PRP is better?
Sure. So ablation is a standard treatment we do. Some people listening, they may have heard of ablation for like arrhythmias. They do like an ablation on heart nerves to get the rhythm back. So in pain management, we'll basically burn nerves. So you place a needle near a nerve that just senses pain from some area. So it's real common in the spine. So if you have arthritis in the spine, we'll do some test blocks to make sure your pain goes away temporarily. And then we can do this ablation procedure. And it's really great at blocking pain. And it lasts for about a year, until the nerves grow back. So it's not permanent, which is good. But the same nerves that sense that pain often contribute to some muscles. So one thing that happens is it weakens the back muscles.
Oh, okay.
And you need those muscles to support the spine structures. Mm-hmm. So that's one of those things where once you start, things typically get worse.
Oh, gotcha.
It's kind of the same as steroids. Like once you start, things are getting worse.
Okay.
So all these traditional treatments, they just kind of mask the pain.
Yeah.
People just typically get worse. So with PRP, you can inject it right into that joint and get the same pain relief. And then you can also inject it into the muscles to stabilize the muscles. So it's really the exact opposite. People are getting healthier instead of less healthy, and they're still getting pain relief.
Well, it's really exciting to see that you're on a path to help us get better over time. And the traditional modalities might be in a different path. So glad to hear that a lot of your ideas are taking the right path.
Yeah, it's definitely, the field's growing. There's a lot of momentum. There's a lot of places that you can get the traditional treatments, and I still do some.
Yeah.
Some of the things I'm talking about, I'll dilute the dose of steroids if I use them, so it's much safer, not as toxic to the body.
Yeah.
I'll do ablations for, select people that really don't have any other options for whatever reason. Mm-hmm. But at the end of the day, I opened this clinic to offer, these alternative treatments, so I'm glad that it's growing.
Where can we find you here in Naples?
Sure. So the company is Naples Regenerative Institute, And it's right down on Tamiami Trail, like kind of towards the mall, like close to the mall in that area. Instagram, it's Regenerative Ortho Doc. You know, I'm not on there too often, but I do post some cool stuff now and then.
Well, thank you so much. It's been a pleasure.
Thanks for having me.